Welcome to Lesson 11, the last video in the Module 8 series, and the third video in Technologies and Disorders. And in this video, we're going to be looking at kidney function. Again, we're going to look at the causes of the loss of kidney function, some technologies, and then look at their effectiveness. So the function of the kidney. It is to regulate the concentrations of soluble substances in the blood. It's used to maintain a healthy water and salt balance, but also plays an important role in removing nitrogenous waste from the blood, which is then excreted in urine via the bladder. So we can see here the different structure of a kidney. So the human body has two kidneys placed at the back in the lower back section, and we can see that they are bean-shaped, and there is in fact two of them that are connected to the urinary system. Within the kidney, there are millions of different units called nephrons, and these nephrons are shaped like the image on the right. So we can see the first section after the cortex, in the cortex, is the glomerulus, and this is a bundle of blood vessels that move along the nephron. In the glomerulus is located inside the Bowman's capsule, which is the structural unit that allows the substances to pass through. And then we see the nephron shaped in the kind of downwards spiral over here, all the way down, then moving back up, and then going into our collecting tubule, which we see gathers urine from lots of different nephrons. And we see the lower half, which is in the yellow color, is called the medulla, which is the different section of the kidney. Within the nephron, we see different concentrations as we move through, depending on what is moving both in and out in either an active or a passive way. So active means it's requiring energy, passive means that no energy is being used for that substance to move. So we can see as the medium passes through the nephron, we can see that it's flowing in the downwards direction. So the proximal loop of Henle to the distal loop of Henle. So, descending, ascending, and then we have our proximal and then our distal tubules. And we can see here that as the flow moves down the loop of Henle, we can see that there's the passive diffusion of salt into the loop of Henle, but we see the diffusion of water moving out. And then as we move through, keep moving through the nephron, we see that as it moves back up the loop of Henle, we're seeing that transport of salt is actively moving out of the liquid. So it's where we see salt being reabsorbed for our body. And we can see that as it moves back up, the salt concentration here is quite low. And as we then move down the collecting duct, we can see that this is where water is diffusing out back into our body to be reabsorbed. So passive filtration happens in the glomerulus and the Bowman's capsule. The selective reabsorption is a passive process, and it occurs in the proximal and distal nephron tubules and in the cortex and loop of Henle. Active secretion is occurring in the proximal and distal nephron tubules. Water is removed in a passive way, and then we see excretion, which is the removal of urine via the collecting tubule into the ureter of the bladder. So some disorders that may happen with the kidney. So there's glomerulonephritis, which is the inflammation of kidney filters, diabetic nephropathy, which is kidney damage resulting from type 1 and type 2 diabetes, reflux nephropathy, which is kidney damage caused by a leaking valve in the bladder, hypertension leading to nephrosclerosis, or polycystic kidney disease, where we see cysts in both kidneys, which is not detectable until adolescence. So here we see nephropathy, which is a kidney malfunction caused by diabetes. We can see that there's protein present in the urine, and unhealthy glomerulus protein molecules spill into the urine because of the damage in the capillary wall here. Polycystic kidney disease. So on the left, we have a normal kidney. On the right, we have the kidney with the cysts. So obviously this leads to kidney malfunction and may in fact lead to kidney failure. And this is where we see some psoriasis in the liver, which may be caused due to the alcohol consumption, but we see lower down here, we see kidney stones, which can be passed through these kidneys. Some technologies that we use to assist with kidney disorders. So dialysis is the main technology we're going to talk about here, and it's where the diffusion of solute molecules happens through a partially permeable membrane in a dialysis machine. This aims to maintain life, but imposes severe restraints for work and travel. So there's peritoneal dialysis, which occurs inside the body, and it's the insertion of a catheter tube, or hemodialysis, which requires specialized equipment, and the machine acts as the artificial kidney to clean the patient's blood. So here on the left, we see a renal dialysis machine, and we can see here that outside the body is where the filtration and those reabsorptions is happening before the blood is then returned to the body. So we're taking out any of the waste products we don't need. Or on the right here, we have peritoneal dialysis, where dialysis fluid is placed in and then removed from the cavity of the abdomen for flushing away of waste materials. We may also have people with impairments to their kidney function undertake kidney transplant, and this is usually for end-stage kidney disease. They may be from living donors, so these living donors may be related, unrelated but known to the person, or non-related kidney. And however, if we do get a kidney transplant, it does require the continued use of immunosuppressants, and we can see here that we're looking for the best match where we won't get rejection happening, so that the person can live with this kidney that's been donated for much of their life. That concludes lesson 11 and our module 8 series. Good luck for your HSC exams, and we might even do a revision series.